Well, greetings, amazing students, and welcome back to another week of Lifespan Development Sci 120. Thank you for joining me again for this week for our lectures. You all are doing well. Hang in there. I know it's been a busy semester. So, for this week's content, we are going to focus on a topic that you will come across over the course of your nursing or speech pathology career. It's not if you come across this content, it's when. And the topic that we're going to discuss this week can be a little difficult, right, to hear and to process. It may be a little triggering in sometimes. The focus of our topic this week is going to be on child maltreatment and trauma-informed care, okay? So the topic is going to focus, when we say child maltreatment, on child abuse, and we're going to discuss how do we engage in what is referred to as trauma-informed treatment in your future nursing or speech pathology practice that will make you better equipped to be able to serve individuals who have experienced abuse and neglect in their lives, whether that be as children who are coming to see you or as adults who have experienced abuse or neglect. We are going to talk about some of the definitions, the legal definitions of child maltreatment as they exist in the state of California. I'll be drawing upon my own experiences as a social worker in serving individuals who have experienced abuse and neglect. What I'm also going to do is tie our topic of child maltreatment to research. There's a huge body of research around adverse childhood experiences that we are going to discuss that will be very informative for your future career. So before we dive into the lecture today, what I wanted to do was share with you, if you do find that the content is challenging emotionally, right, for you. If it brings up some feelings or triggers something for you, know that's absolutely okay. You're not alone in that process, right? Many of us have experienced trauma in our childhoods, and so when we revisit lessons around this topic, some things can come up. But second, what I wanted to let you know is if you do feel those feelings coming about, you feel like maybe you're having a difficult time managing as you remember some of these experiences, if they pertain to you and your family, feel free to reach out, right? Reach out to me, email me, call me, and what we'll do is we'll set up office hours and I'll make sure that we link you to like any sort of support that you need. I'm here for you to talk through that, okay? And so I just want to let you know I'm here as a resource for you. So without further ado, we'll go ahead and dive into our lecture content for today, focusing on child maltreatment and trauma-informed care. And I'm going to go ahead and bring up our slides for today. Now, when we start for today, I'm actually going to start with some statistics, some national statistics related to child abuse. Now, throughout the lesson, you may hear me reference the topic as child abuse or child maltreatment. I wanted to let you know those two terms were used synonymously throughout my career in serving in child welfare. And so you may hear me go back and forth between those terms, but we're talking about the same thing, okay? Abuse or neglect, trauma that occurs in childhood prior to the age of 18. But we're going to talk about what that means for us as we expand and continue on throughout our lifespans. So let's start with some national statistics. And then what I'm going to do is I'm going to shift us into some local statistics related to the immediate area around campus, around our community here in Riverside, all right? So to start, nationally, there's a child abuse report that is made about every 10 seconds. Anytime that there is a suspicion of child abuse, I'll talk about this process in the lecture, but individuals, you, me, other helping professionals, anyone can call a child abuse hotline and report suspected abuse. And throughout the United States, that call to the child abuse hotline, that report is made about every 10 seconds. And every day, about 5 children die as a result of child abuse nationally in our country. And every year, over 3.6 million child abuse referrals are made. Now, what's important and what I've seen in my experience serving as a social worker is that one report can often include multiple children in one household, right? It's not uncommon for there to be one or multiple children living in one house. And so when we factor in that a child abuse report can equate to multiple children in one house, what that means is that over 6.6 million children are impacted every year by child abuse, right? So this is a large issue that we face in our country. It's unfortunate that we face this reality, but it's a reality nonetheless. What does it mean for you as future nurses and speech pathologists? What it means is there will come a time in your career where either an adult may disclose a history of child abuse that is now impacting their health as an adult. Believe it or not, that can happen, right? Emotional and physical abuse can impact one's health later. I'm going to talk about that research later. Or you may come across a child who discloses an episode of abuse to you, and you're going to want to know how to handle that within your future practice. And so that's why we're discussing this topic today. Now, what I'd like to do is move on to local child abuse statistics, and these are related to Riverside County. All right. And so I want to walk us through a little bit of data because, like I said, nationally, it seems so far away. But if we discuss the topic in regards to our immediate region, it becomes more apparent, it becomes more real for us. And so, on average, in the year, there's about 58,000 calls, almost 59,000, in which there were calls made to the Children's Services Division hotline. Okay, and those were just the number of calls that came in to the Child Services Division to the hotline number for child abuse. Now, not all of those calls are necessarily about reporting abuse. Sometimes those calls could be questions about the legality. Can I do this with my kid? Can I not? Right? What's the legality around food or shelter in the home? Can I get some advice from a social worker about working with my kids? So not every single call that goes to the child abuse hotline is about reporting suspected abuse. So when we break that number down of 58,000, what we see is about half of those calls are reports of suspected abuse or neglect. So listen, every year, about almost 30,000 calls are made to the child abuse hotline specifically about suspected abuse or neglect. And of those, the children with maltreatment allegations, so children impacted by those child abuse reports, equates to about 38,000 children impacted, almost 39,000. That's in Riverside County alone, okay? And of those allegations received, 86% about resulted in an investigation from Child Services, which meant that a social worker went out to the home to investigate those allegations and to determine if they were substantiated. Substantiated would mean that there is a likelihood, a strong likelihood, and evidence of that abuse has taken place in that home. And of those allegations received, those 33,000, right, 13% were found to be substantiated, equating to about 5,000 children impacted right that year. Now, some of you may say, wow, Riverside County is such a large county. 5,000 kiddos impacted by child maltreatment every year doesn't seem that high. But think about this, that's every single year, right? So that's year over year, potentially roundabouts, what we're looking at. When you also factor in, though, the lasting consequences of child maltreatment throughout the lifespan, then what we're saying is there are generations of children growing up where child abuse was present, okay? And remember, this is what was found to be substantiated. Out of these 33,000, there could be more, right, that just didn't have the evidence at the time for it to be substantiated. So these numbers are relevant, right? When we equate these numbers to people's lives and we factor in that these lives occur, right, continue for generations, there's a potential real impact, a significant impact on society when we examine this data. So a couple of things to think about. Like I said, in my career, I primarily worked with foster and adoptive youth, as well as youth who were adjudicated, meaning they have become a legally part of a system. Sometimes that's child welfare, sometimes that's juvenile justice, but they've come into a system of care. And as a result of that, many of the children, the circumstances which led them to interact and become a part of that system of care, their adjudication was often due to abuse and neglect. And over the years, I've seen, and we've seen in the research, that there are disproportionate rates in which foster youth are impacted as a result of the trauma they experience. They are more likely to experience other life challenges as a result of that abuse and neglect later in their lifespan, into their teenage years, adolescence, young adulthood, middle adulthood, right? I've worked with older adults who are still grappling with the impact of child maltreatment, and they're in their 60s and 70s. So I wanted to share some data around foster youth in particular. What we've seen in our research is that 6% of foster youth have attempted suicide and 17% have contemplated suicide in the last year. 25% have also experienced mental health challenges, mostly depression. In regards to education, we see that foster youth who have turned 18 would largely be unable to attend college, would largely be able, to attend college, but need help to see how it's possible. So they're saying, I have a goal of wanting to go to college. I want to pursue a career for myself, but I lack the resources and the support, right, in order to find firm guidance, clear direction on how to accomplish that goal. In regards to lifelong connections, a third of foster youth report not having enough tangible, emotional, or advice-giving supports. They don't have enough of a network of people that know and love them in their lives that they can call on when they need help. Think about the fact, right? I have my cell phone here and I hold up my cell phone. Think about someone that's in your cell phone. You probably have a number in there, a person that you know has got your back always. And you know that if you needed something and it was an emergency at 3 o'clock in the morning, you could call that person and you know they would be there for you, right? Now, think about if some of you may have multiple people in your lives that you know have got your back like that. For many of our foster youth, they're lacking that lifelong connection, that firm connection. And so as a result, they don't have the same support system as other individuals. In regards to crime, criminality, 15% of foster youth have been arrested in the last 2 years, 7% have had a gun pulled on them, and 13% have been victimized in the last year. 6% have also reported being raped in the last 1 to 2 years. And so, what we have also seen is that where trauma is present in many of our foster youth's lives, they also find themselves more prone to being victims of crimes and also troubles in the relationship. So approximately 1 in 7.5 youth didn't disagree that their partner tries to stop them from seeing their friends or family. This points to what we call intimate partner violence, sometimes referred to as domestic violence. And 17% of foster youth have reported being threatened or experiencing violence in their relationships. 13.5% have also then perpetrated that violence, meaning acted out that violence in their relationships as well. Now, does that mean that if you are a foster youth or you come from a foster or adoptive background, that you are locked into these statistics? No, not at all. But what we see in research is when we examine the large volume of foster youth or adoptive youth in our country, considering the trauma that they've experienced before the age of 18, many of our foster youth are struggling in some of these areas as a result of that child maltreatment. Okay, so that's what I wanted to share with you. Now, what we also see is when we see children who have experienced child maltreatment prior to the age of 18, from younger years up until their teenage years, trauma it impacts individuals, impacts them in their behavior. And so we start to see specific behaviors that sometimes can present as symptoms where child maltreatment may have been present for that individual. Some of the symptoms that I've seen in terms of behavioral challenges from individuals who have experienced severe childhood trauma at a young age may include physical or verbal aggression, defiance, right? Like just straight out, like I'm not going to do something that you ask me to do. Severe mood swings, right? Going from extremely happy, extremely high to extremely low. Depression, isolation, poor boundaries, and even hypersexualized behaviors. These are just some of them, but we're going to talk about that a little more in the subsequent slides, okay? And I'd like us to remember for a moment, right, when in our previous lecture, when I said all behavior is communicative. So what that means for you as future nurses and speech pathologists, you may see a client where you're unaware that they have experienced child maltreatment in their lives. And so they're coming to you and they're saying, look, I have a physical illness that I'm battling. I don't feel well physically. But you also may experience things about their behavior where maybe they are verbally aggressive or defiant when you're speaking with them. Maybe they seem really depressed or super high from one moment to the next. And so what I want to share is remember, all behavior is communicative. Rather than take that behavior personally and say, this person has an issue with me, to stop and consider maybe there's more going on in this patient's life than what I truly understand or realize in the moment. Maybe it's enough for me to ask a few follow-up questions to get to know this client better so that I can serve them better. So remember, all behavior is communicative. These behaviors, though challenging to deal with, are communicating something to us, okay? Now, before we go into some of the secular definitions of child maltreatment, the legalities behind it, and we go into trauma-informed care, I want to start with some biblical principles that will found our discussions, right? There's actually lessons that we learn in the Bible about children, about families, and about raising them. And I just want to highlight a few for you. One, we see in Mark chapter 10, when people were bringing children to Jesus, right? And Jesus was a busy guy. He always had crowds around him, people demanding his attention and time, hoping for miracles, things of this nature. And in that moment, these people were bringing children to Jesus to see them. And the disciples kind of stopped, these folks that were bringing children. They said, hey, don't bring him around, right? He's a busy guy. We've got stuff to do, right? And when Jesus saw this, he says to them, he says he became indignant. So he was irritated by this. He didn't want the children to be stopped. And he said to his disciples, no, let them be, right? Let them come to me. Don't get in their way. The kingdom of God belongs to such as these. Truly, I tell you, anyone who will not receive the kingdom of God like a little child will never inherit it. So it's really interesting that in this case, Jesus stood up for children. Children at the time were not valued members of society. You did what you were told, right? You spoke when you were spoken to. And so children didn't have rights in society. Jesus flipped that upside down and said, no, my Father holds them in the highest esteem. In fact, the more childlike you are in your innocence, in your optimism, in your hope for the future, those are the ones who will enter into my Father's kingdom. Second lesson we learn is from Proverbs when it says, start children off on the way they should go, and even when they are old, they will not return from it. Right? A reminder that the more we invest in children, the more we have the difficult conversations and decisions that we make in the short term when a child is young in their life, we reap the benefits. The child is better off living in their full potential when they grow older. The habits we set for our children at a young age in our households and our community, it sets the tone for their future development across their lifespan. And finally, in Deuteronomy, right, it talks about these commandments that I give you today are to be on your hearts, are to be on your hearts. Impress them onto your children. Talk to them when you sit at home and when you walk along the road, when you lie down and when you get up. In other words, we're constantly teaching our children lessons. What is on our heart, right, is what shall become our children's inner voice. And if we're not careful about the lessons that we're not only speaking verbally, but non-verbally through our habits and our actions, right, towards them and towards others, our children pick up on that. Okay. So I just wanted to share those three lessons for you. Now, what I'd like to do is discuss the societal impact of child abuse, right? It's a big issue. It impacts many children over the course of their lives and is passed down generationally. We're going to talk about that for a moment. I want to remind you of that saying, remember, that I shared in the field, that hurt people hurt people. And so what we recognize in the field of psychology is that the cycle of trauma will continue without clinical and societal intervention, right? Children will act out what they've experienced in their lives with others and their future relationships with others if there is no intervention. If we equate that to money, though, what we also see is that about $89 billion are spent annually in the United States treating mental illnesses, some of which come from child maltreatment, from the trauma that individuals, adults experienced in their childhood. And we also see that within the United States, mental health and substance abuse are the leading causes of disease burden in the United States, meaning when we factor in all the costs, right, of the financial costs, the morbidity rate, the treatment, the medication, the systems involved, the United States is grappling with two issues that dominate our healthcare system, and that's mental health and substance dependency. I don't believe that that's an accident, right? That the notion of individuals trying to seek to take care of themselves mentally based off of the trauma that they've experienced and emotionally is that they sometimes turn to substances to self-medicate and manage that trauma on their own. And so this has a huge potential impact for our society, right? Now, I want to remind us too of Mark chapter 10, and this is why I want to thank you all. You have entered into a helping profession. Your goal is to become nurses and speech pathologists. You want to make a difference in people's lives. You have chosen a career of servanthood. And I want to remind us that Jesus says, rather, whoever wishes to be great among you will be your servant, and whoever wishes to be first among you will be a slave to all. In other words, those, right, who demonstrate greatness in terms of God's love are the ones that serve the most. And I want to commend you on continuing to aspire and to work every day, right, to earn a career, right, in the helping professions. So I want to say thank you for that as you continue. Let's talk about some definitions of child maltreatment in particular. Now, the definitions I'm giving you here are definitions that exist within the state of California regarding child maltreatment. Each state will have its own child welfare institution codes that outline what are the legal definitions of abuse in that state. Now, there's not a whole lot of variance, right, between states. Many of the same items are on here, but what I want to provide the caveat is that you might see nuances in the language change from one state to the other. But for all intensive purposes, we're going to work off of California's legal definitions of abuse. Here in California, there are four different categories or types of child maltreatment that exist. Those categories are physical, sexual, emotional, and psychological, and neglect. Really quick question before I dive into those. Out of these four categories that are here, which one do you happen to think is the most common form of abuse um, in our country, right, that we experience in the US? Would you think that that's physical abuse is the most common, sexual, emotional, psychological, or neglect? If you answered neglect, you would be correct. Actually, neglect is the most common form of abuse that we see reported and is investigated within the United States. Now, I say that with a caveat, right? Reported and investigated. That doesn't mean that these others don't take place at high rates, right? We happen to just see a lot, especially when it's sexual or physical. We see a lot of these making headlines in the news, but what we see are higher rates of neglect taking place. Now, with physical abuse, the definition of physical abuse, right, per our Child and Welfare Institution Code, is that intentional use of force or harming the child's health, development, or dignity, and it's mostly punishment driven. So this is when physical abuse harm is done to the physiology, the body of the child. Sexual abuse is defined as sexual abuse refers to the participation of a child in sexual acts, act aimed at the physical gratification or financial profit of the person committing the act. 30% are perpetuated by relatives, and over 1/3 are minors. Okay. And so it's important to note that this is the definition of sexual abuse, which also includes financial profit, right? So that allows us to also define abuse in other terms, such as human trafficking. Okay. So that's important. Emotional and psychological abuse, and this is the one that's also the most difficult to prove, and you'll see why when we read through the definition. Emotional psychological abuse is defined as chronic or pervasive, meaning ongoing. When we say something is a chronic condition, it extends for a longer period of time. Chronic or pervasive, ignoring, shaming, terrorization, humiliation, IPV, which is intimate partner violence, or DV, which is domestic violence. Exposure may also amplify the impairment. Psychological maltreatment is the most challenging form of abuse and neglect, also the most difficult to prove. Because unfortunately, right, what we see is that emotional scars are left behind when these things are happening on a consistent basis. But that doesn't leave bruises, right? It's hard to prove what was said and who said what and how it was intended and the tone and all of these things. And so emotional psychological abuse usually takes years, right, to be able to investigate and found and substantiate, okay? And then finally, there's neglect. Now, if you notice, neglect is actually broken into multiple categories. We have supervisory neglect, physical neglect, medical, emotional, educational, and abandonment. Neglect can take form, many different forms. Sometimes what that means is that parents are simply leaving their children unattended, and those children may find themselves in dangerous situations. Maybe a toddler is roams out of the house, right, and is now wandering the street at 2 a.m. Physical neglect may be you're not providing the basic necessities to keep a clean and safe home. Medical neglect, right, is failing to take a child in too long to be seen and treated for a medical condition. So at times, this may show up in your future career, right? A child comes in with a broken arm, but it's almost already starting to heal. And the doctor's saying, hey, this arm's been broken for a while. Why didn't you bring him in early? That could lead to substantiated or at least suspected medical neglect. Emotional neglect is that lack of support or nurturing environment in the home. If a child doesn't go to school for long periods of time, extended periods, educational neglect may be present. And then abandonment, if a child is just left, right, alone, a parent walks away from the situation, that can also be that case, okay? So there are warning signs with each of these situations. Now, I want to caution you. I'm going to present warning signs that sometimes may point us in the direction of suspected child abuse. But if one of these items is present, it could mean that there's suspected abuse, but it doesn't always mean that abuse is present, right? But there are rather warning signs giving us as practitioners something to look towards and look into and say, maybe there's more here, right? So potential warning signs, and I won't go through all of these for the sake of time, but you will have access to the slides, right? Warning signs for emotional abuse may include things like a child feeling excessively withdrawn, or fearful. Maybe they show extremes in their behavior, like they're extremely compliant, right? Or very passive or extremely aggressive. If you notice here, we're talking about extremes, not middle ground, right? But very strong behavior one way or the other. If the child doesn't seem to be attached to the caregiver, there's no relationship there, right? That could be a sign. Let's look at physical abuse, right? Frequent injuries of unexplained bruises or welts or cuts could be a sign of that. It's a child may be hyper vigilant, which means always watchful. They're constantly scanning their environment to look for threats, could be an indicator of physical abuse. Maybe the child flinches or shies away from touch, right, or sudden movements, or may seem afraid of going home because they're worried about what would take place there. Or maybe the child's wearing inappropriate clothing, right? Hoodies, long sleeve shirts, long pants, a beanie to cover up wounds, right, from physical abuse, even when it's 105 degrees out, right? These could be signs of that. Neglecting children can look kind of similar in some ways, right? You can have children who don't have a jacket and it's raining and freezing outside. And so the family just could not afford a jacket. And so they're out there in the cold. Clothes that might be ill fitting, filthy, or inappropriate for the weather, right? Hygiene maybe is consistently bad. We're not talking about coming in from PE class, right, and smelling a certain way after a PE class, but we're talking about constantly showing up unbathed with matted or unwashed hair, right? Maybe is frequently missing or late from school because there's no one there to get them up in the morning and going to school. Sorry about that. And then finally, warning signs of sexual assault could include children. Maybe they're coming into the ER to you to be seen and they have trouble walking or sitting. Or maybe children become what we call sometimes hypersexualized, where they start to display knowledge or interest of sexual acts that are well beyond their age, right? They're too young to have been exposed to that over the natural course of their lives. And so something may have been introduced there, which causes us to kind of look more closely at that situation. Maybe the child doesn't want to change clothes in front of others. Or participate in physical activities. They have a lot of worry about taking their clothes off. Also, the presence of sexually transmitted diseases in children, specifically under the age of 14, when it comes to child abuse, is something to consider. Okay, so things to keep in mind, right, as we're looking in this practice and working with children. Why is this important? Why is it important for you to know? Well, there's actually a law in place and it's called mandated child abuse reporting, right? And in this case, all persons who are mandated to report are actually required by law to report suspected. Notice it says suspected child abuse. It does not say founded child abuse. So in the United States, anyone that's working with children has a legal responsibility. You're required to report suspected abuse. What that means for you is you do not have to investigate and determine if that's substantiated. A social worker does that, right? But if it's suspected, you're required to call it in by law. And it outlines here how you would do that, right? So to make a report, an employee must contact an appropriate local law enforcement office or county child welfare agency listed below. And that includes things like a police or sheriff station, county probation department, or it says a county child welfare department. Now, in each county, all right, there is a child abuse hotline, and it's specific to the San Bernardino, Riverside, Los Angeles, whatever the case is. And when you, as a helping professional, are confronted with suspected child abuse, it's your legal responsibility to call that in. I don't want you to worry. You're actually going to receive further training on child abuse and mandated child abuse reporting once you get into your future careers. But the important thing to note is you want to be able to recognize when you're legally responsible to do so, and it's not as scary as it seems. You call the number and give them the information. There's a form you complete, and then you can either email that sometimes or fax that in. Now, the report should be made immediately over the telephone and should be followed up in writing. Okay, so that's what we're sharing with you now. So I want to point out, right, here's a list of everyone that's mandated a mandated child abuse reporter. If you notice what's in common with all of these roles, like administrators, teachers, public assistant workers, social workers, look under here. Physicians, surgeons, right? Podiatrists, we've got nurses on the list, licensed nurses, all of that, right? If you notice, they all have something in common. They all potentially have access to children. They may interact with a child at some point in the course of their career. So this is why all of these categories fall under the notion of mandated child abuse reporters, okay? Now, what happens if you fail to report child abuse? Well, it's important to know that in the state of California, while it's required to report suspected child abuse, if someone fails to do so, that person will be charged with a misdemeanor offense as opposed to a California infraction or felony. As such, the crime is punishable by either county jail for up to 6 months or a maximum fine of $1,000. Now, let's say someone fails to report, and as a result, that leads to the child experiencing death or great bodily harm, then imprisonment can fall under 1 year in the county jail or $5,000 of a fine. Now, some of you may be saying, wow, that honestly doesn't seem that large, that impactful. Like you're talking about $1,000 or $5,000 if a child were to die, right, as a result of child abuse. I would agree with you on that. But you also want to factor in the larger impact that you may experience in your career. In addition to this, your license can also be revoked, right? Your license as a therapist, as a social worker, as a nurse, can be revoked, and you would not be able to practice, right, in your field ever again. So a couple of things to keep in mind on why this is so important, okay? Now, what I'm going to do is I want to float some scenarios your way. These scenarios are potentials for you to kind of determine, like it's not a quiz for points or anything, but right, just to kind of recap what we went through. You're going to determine, is the scenario I'm putting in front of you reportable, not reportable, or would you call the hotline for information to ask? If you're ever in doubt, right, of whether something is suspected child abuse, you could still call that hotline, ask them the question, and the social worker on the other line of the phone is going to point you in the right direction and advise you whether you should report or if it's not reportable. All right, and so that's what we're going to determine here. So let's look at the first scenario here. An 8-year-old boy presents with bruises on his buttocks, arms, and thighs and states he's fearful of saying how he got them. Do you think that that's reportable? Would you report that? Would you not report it? Or would you call for information? What do you think? If you said reportable, you are correct. You don't know if physical abuse is taking place, but it is potentially suspected, so you would want to call this in, okay? Second scenario, a 19-year-old woman discloses a history of sexual abuse that she had not shared to anyone before. What would you do? Would you report it? Would you not report it? Or would you inquire? Would you call it in? What do you think? All right, if you said it's not reportable, then you are correct. And why is that? Well, you wouldn't call the child abuse hotline because the person is now 19 years old. They are no longer a minor. However, this is important to note. You do want to contact law enforcement because a crime did occur. The difference is the information, the knowledge was brought to you when they were an adult. So the law enforcement needs to get involved, investigate the matter, and determine statute of limitations, right, if they occur at all in this case, and when this abuse took place and who was involved, okay? So trick question there for you, but that's what the response would be. Two more scenarios for you. An 11-year-old girl says her dad screams at her and calls her names, but does not hit her when she is angry. When he is angry, okay? So he doesn't hit her, but yells and screams. What do you think? Would you report it? Would you not report it? Would you inquire? It's enough to inquire, right? So we don't know if this meets the level of abuse. We know that investigation will need to take place. The only piece to that, though, is we don't know if it's not happening either, right? We're uncertain. If you're uncertain, call in to inquire and allow the social worker to give you guidance there. Let's last one here. A 15-year-old male discloses he was sexually abused by a family friend at a party, but does not know the name of the friend or the address. So all of this kiddo is telling you is, look, something happened at a party. It wasn't okay. And I don't know anyone there, though. I just came with a friend and I don't know even where the house was. Still reportable. You still want to call that in to the child abuse hotline, okay? And you want to make sure that you're sharing as much information that you have so that that information can also be cross-referenced with law enforcement and they can begin to investigate this matter, okay? So very good. I hope you found that helpful. That was just a recap of what we went through. So now we talked about child maltreatment. We talked about the definitions of child maltreatment. What I want to do now is talk about what we do about that. How do we treat that? How do we address it in your future career as nurses or speech pathologists? The field of medicine, the field of therapy, speech pathology has moved into a realm of understanding that trauma occurs at high rates in our society, just like I gave you those statistics at the national and county level. And as a result, it's been infused into the training of nurses, of speech pathologists, of social workers, counselors, all of these things. And it's led us into an area now that we refer to an era, if you will, of trauma-informed care. Trauma-informed care, which means that we all receive some kind of light trauma-informed training, sometimes deeper levels depending on the focus of your job and your expertise. But trauma-informed care, you'll come across this training in your careers, even as nurses or speech pathologists. The definition of trauma, okay, is an emotional wound resulting from a shocking event or multiple and repeated life-threatening and or extremely frightening experiences that may cause lasting negative effects on a person, disrupting their path of healthy physical, emotional, spiritual, and intellectual development. Do you see why this ties to our class of lifespan development? The definition of trauma is that things may happen to us that are difficult in our lives, which impact our ability to develop at the same rates of others throughout our lifespan. So that's our definition of trauma. We also know through research that there's variables of trauma. How we experience and react to trauma is very personal. It's very individualized to the person. And so there are certain variables that matter in terms of how someone remembers or is able to recover from trauma later in their life. So a couple of things that we consider when we're examining trauma-informed care, when we're considering trauma, is the age and developmental stage of the client, right? Did this trauma occur when they were a toddler? Did it occur when they were 14 or 15 years old? Sometimes that makes a difference. The perception of danger is what occurred in that traumatic event considered dangerous by the people who experienced it. If they're used to a certain level of danger in their lives all the time, they may have looked at this and said, this wasn't very traumatic for me. But if someone else were to examine that same incident and they said, nothing like this happens in my family or my neighborhood or whatever the case is, they may find the event highly traumatic, right? Whether the person was a victim or witness of that trauma, right? Were they watching someone being mugged or were they the one that was being mugged themselves? Sometimes that matters in terms of recovery from trauma. Relationship to the victim and the offender, were they related? Did they know each other or was this a complete stranger? What were their past experiences with trauma? Have they had chronic experiences with trauma over their life? And this is another one that's been added, or was this their first traumatic experience? Um, av- um, Adversities faced following the trauma, right? So sometimes a traumatic event takes place. Maybe it's a life-threatening auto accident, right? And so even though the accident has passed, medical bills rack up, right? Your body doesn't work the same way as it used to. Maybe you're constantly in pain. Maybe you need to go to physical therapy. Maybe you can't afford those treatments. And so there are several barriers that follow you as a result of that trauma, which remind you of the trauma that took place in the beginning. So these are things to consider. And finally, the presence and availability of support and resources. Again, those close relationships. Do you have people that you can talk to, confide in, pray for you, that can lend you money for treatment if you needed it, that could drive you to a doctor's appointment? All of these things can impact someone's recovery following a traumatic event, okay? Now, really quickly here, we're almost kind of getting through the lesson. Stay with me, you're doing a good job. I want to connect childhood trauma to a body of research that was done. There was a research study that was conducted, a massive research study, in which to this date, data is still being collected, that gave us, both in the field of psychology, as well as in the health sciences, just like nursing or speech pathology, that gave us tremendous insights into the impact of trauma and the connection to trauma being from emotional to physiological, that it is highly possible for an individual to have experienced physical or even emotional trauma, and there are symptoms that manifest physiologically later in that person's life as a result of it. The name of this study was called the Adverse Childhood Experiences Study, or ACEs. Okay, so we'll refer to the study as ACEs, right, in this process. Now, the CDC conducted this study and uncovered that after they saw the data from the study, there was a stunning link between childhood trauma and chronic diseases people experienced as adults, as well as social emotional problems. So what they saw was when trauma was present in childhood before the age of 18, it was linked to other chronic health conditions such as heart disease, lung cancer, diabetes, and many autoimmune diseases, as well as depression, violence, and also being a victim of violence and even suicide. It was a 10-year study that examined data across 17,000 people, and it was the largest of its time, okay? And what we saw that there was 10 types of childhood trauma measurements that occurred in this ACEs study. There's 10 questions on the ACEs study, all right, that ask questions in multiple areas. The first five are personal questions that relate to the different forms of abuse: physical, verbal, sexual, psychological, and emotional, okay? Five are related to other family members, such as substance dependency, and talking about those things. So I want to show you what those 10 questions are, okay? Those 10 questions on the ACEs study are here as follows. Now, what would happen is that every time you answered yes to a question, you got a score of 1. So if you answered no to these, your ACEs score was 0. There was 0 trauma present in your life before the age of 18. If you answered 10 to all, yes to all, your score will be 10. So obviously, the higher the score, the more trauma present in your life before the age of 18. Let me remind you of what I disclosed early on in the lesson. As you go through these and you were to look at these questions, you may say to yourself, wow, I didn't realize I had experienced so much trauma before the age of 18. You may be reminded of situations in your life. And if you have feelings about that or you're struggling with that, please reach out to me. I want to let you know, though, that ACEs are not uncommon. Many of us have experienced trauma before the age of 18. Many of us are answering yes to these questions, myself included, okay? So I just want to remind you of that. I won't read through all the questions, but look at some of the questions here, right? Did a parent or other adult in a household often or very often swear at you, insult you, put you down, or humiliate you, right? This is the presence of those types of abuse. Let's get question number 4. Did you often feel that no one in your family loved you or thought you were important or special, or your family didn't look out for each other, feel close to each other, or supported, right? That could be a form of neglect or absence of relationships. Number 6, were your parents ever divorced? That can be a traumatic event. If you look at number 8, did you live with anyone who was a problem drinker or alcoholic or used street drugs, right? Was substance dependency present, right, in your family environment? Was a household member depressed or mentally ill? So that's asking the question, was mental illness present in your family's home? And did a member of a household go to prison, right? That's traumatic for the family. There's a saying, right, in the field that when one family member goes to prison, the whole family goes to prison, right? Because the whole family is impacted by that traumatic event. So like I said, you would say, depending on which numbers you said yes to, the number of yeses is your ACE score, okay? So here's what we found regarding the ACEs study. Of the 17,000 individuals surveyed, 1 in 4 were exposed to 2 categories of ACEs, meaning 1 in 4 people, 25%, right, said yes to 2 of those questions. 1 in 16 said yes to 4 of those questions. And individuals who experience 4 or more of these incidents said yes to 4 or more of these questions were more prone to emotional, physiological, and psychological challenges into adulthood. Now, I want to break that down into the questions. So if you see there was 3 categories: household dysfunction with some of the questions, abuse, and neglect. The majority of respondents responded yes to the presence of substance abuse in their homes, okay? 28% said physical abuse was present within their homes prior to the age of 18. Neglect, for neglect, emotional neglect was most present. And if you notice here, 36%, the majority said there was none of that present. I didn't answer yes to any of these questions. And right behind that, 26% said 1. If you notice here, 12.5% though, or 16%, if you look at that third highest number here, said yes to at least 2 of those questions. So I wanted you to know this, right? I wanted to reemphasize you're not alone. I don't want you to worry, right? In this notion of, or feel alone and saying, wow, I experienced these things. I might be the only one. It turns out a lot of us have, right? But we want to be aware of our clients' ACEs scores, even ours, because what the data showed was a firm connection between other physiological issues later. What the ACEs score showed, where there's a connection, was to chronic stress syndrome, chronic stress syndrome. And this is when something happens in our lives that's traumatic before the age of 18. And as a result, what the data showed was that it was linked to other things, right? Like, for example, traumatic brain injury or fractural burns, that can occur under the circumstances of physical abuse, right? But the scars or the functionality, the implications of those injuries can last a lifetime, right? We found a connection between ACEs scores and the depression of anxiety, presence of depression, anxiety, suicide, or PTSD. Let's go over to this one of education and occupation, right? That if people experience trauma before the age of 18 and are struggling to manage that trauma into their teen years or early adult years, it's harder for those individuals to stay in college, to stay in school, to attain those educational goals, which has an impact on their education and their career later in life. Other things where individuals, let's talk about alcohol, drug abuse, and unsafe sexual practices. Individuals who experienced traumatic events before the age of 18, for some individuals, especially the higher the count was of their ACEs score, may have chosen to later engage in risky behaviors because they're managing those feelings of overwhelm, of depression, of anxiety as a result of that trauma. So someone that grew up maybe in a highly abusive household may have adopted the habit of drinking or smoking in order to cope with that anxiety. And as a result, they're subjected or exposed to a shorter lifespan because of those practices. And so, if we were to look at the impact of trauma throughout the lifespan based on ACEs, what we would see is here's our adverse childhood experiences. Here's the stuff that happens to us at a young age. See at the bottom. But as we start to increase in our age, what we start to see is some of those experiences can lead to disruptive neurodevelopment, right? How we see, feel, interact with the world changes as a result of that trauma. And as a result of that, we may develop some sort of social or emotional cognitive impairment, right? We may not interact with the world in quite the same way as others do who had experienced less or no trauma at all, which can lead individuals to adopting of health risky behaviors, right? The notion of the drinking, the smoking, the failing to work out, engaging in risky sexual encounters, all of these things, which can lead to disease, disability, and social problems, right? Now the person develops emphysema or lung cancer or liver disease or STDs as a result of those behaviors, which can lead to an early death. And so this was the connection, right, made between adverse childhood experiences, child maltreatment, and chronic physiological conditions later in life. Does this mean that if you answered yes to your ACEs questions that you are doomed to this fate? Not at all, right? In fact, knowledge in this case has a lot of power behind it, because if we're able to address our adverse childhood experiences in our early years or even in adult years, we can change our habits. We can change the way that we treat ourselves and others, which may lead to less vulnerability of acquiring a chronic condition. So I don't want you to think that you are doomed to a fate, right? Quite the opposite. But I do want you to know so that you can help treat your clients, right, on how to manage these feelings should they have had these traumatic experiences in their life. We're going to skip past this for a second and we're going to move to our last message here and then we'll end our lesson for today. So I don't want you to leave feeling hopeless from the lesson, right? We talk about a very hard topic, child maltreatment. It's not easy. We discover our ACEs scores, right? And we think to ourselves, gosh, I've been through so much, right? Am I doomed to this fate? I want to remind you, you are absolutely not. And I also want to remind you as nurses, as speech pathologists, nor are you responsible for solving all the problems of your clients, right? You're also not trained to be therapists. And so part of your goal may be is that once you've reported suspected abuse or you're working with a client who has experienced this, maybe you connect them to services like a therapist or a social worker who's designed to help process these events with that individual. The point is that you're not doing this alone, and so you don't need to lose help. I want to remind us of what Paul wrote in Romans, right? For as in one body, we have many parts, and all the parts do not have the same function, right? And so we're reminded that God designed you to be a nurse or a speech pathologist, and that's okay. But he also designed therapists and social workers and counselors and judges and attorneys and law enforcement, right? To be able to collectively come together and help individuals heal, to hold individuals accountable who have done harm in society, right? And so I want to remind you, don't feel as though you're going through this alone, and don't feel that you need to be the sole person, right? That brings all of this together, right? We're doing this as a team together. All right. So finally, what I want to do is end with our centering verse for today. And we're going to go with an old tried and true scripture verse from Jeremiah chapter 29, verse 11. And it's a reminder of hope, Okay. It's a reminder of hope that in this vast sea of sometimes what we see as child maltreatment, which seems to be endless, seems to be so overwhelming, God puts you in place for one specific purpose. Live by that purpose. And if everyone can do that, we can make this world a better place. And it says, "For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, to give you hope and a future." All right. So for this centering, let's go ahead and put our hands and feet in a nice comfortable position. And let's focus on the word hope. And let's take hope in the fact that there are individuals out there every day across multiple disciplines and career paths that are all serving people and invested in healing, right? The pain that has maybe been caused in their lives from a very early age. Go ahead and take that nice deep breath and close your eyes. And as you exhale, draw into God's presence. Draw into the fact that God is present with you in this very moment, with you in your room. And He's saying to you, don't worry. I have a plan for you. It's a plan to prosper you, to bless you, and not to harm you. It's a plan to give you hope and a future. Go ahead and take that nice deep breath one more time. Stay with it, and we'll come back in just a few moments. Okay, go ahead and take that nice deep breath. Go ahead and open your eyes, and you can come on back. Folks, I want to thank you so much for joining the lecture today. Again, I want to remind you, if you need to talk, if you want to process anything, shoot me an email. I'm here. I'm happy to connect with you. You're not bothering me at all. We'll set up office hours, buy you a cup of coffee, whatever the case is. Thank you all for joining in today's lesson. Have a great week. Take care.